Welcome to the Plastic Surgery Secrets Talk, a podcast where we go behind the scenes of everything in the plastic surgery and aesthetics world. I'm Dr. Jeffrey Spiegel.
And I'm Dr. Onir from the Spiegel Center just outside of Boston. Today we will be going over all things hair with our special guest, Dr. Ronan.
All right.
So Stephen Ronan, thank you for joining us. This is so awesome.
Thanks for having me.
All the way from Blackhawk, California.
All the way from the Bay Area. Exactly.
Yeah, you actually wanted to come to Boston, huh?
It was an early
You
flight.
didn't have a choice.
I got up at,
Or you forced
at
into
3:30
it?
today.
But you get up early every morning.
Yeah.
Wait, did you fly your own plane?
No, I actually, this is the first time in probably 3 or 4 years I went commercial.
Did you fly the commercial plane?
No, I wish, yeah. No, I was in the back in a tiny little seat.
Oh, yeah.
So I know what brought you into Boston. Why don't you, talk to us about that?
Well, tell us about your practice.
All right, let's
So
talk
my
about
practice
that.
is, I'm private practice. Up until a few months ago, I've been solo practice and do sort of a variety of things. Surgery, laser technology, injectables, skincare, esthetician kind of things. Sort of broad focus.
What's left?
Having a surgery center.
Oh, okay.
Operate a surgery center. And then as a few months ago, I went from solo practice into group practice, which has been quite a journey.
Yep.
So what is that group practice?
Well, that's how we know
That's
Dr.
a
Ronan.
secret.
We are part of a secret, not so secret anymore, a secret society of elite plastic surgeons, right? It's the, what are those groups called? The
It's
ones
like-
who
So we formed a platform.
like the Masons.
It's like the
Yeah.
Masons, right.
So we formed a platform with our friend Ross Clevens, and the three practices came together.
We ought to get him on a podcast sometime.
Maybe in September. I don't know. We'll see.
And so we're sort of a physician-controlled, physician-centric platform. We're going to acquire a whole bunch more practices and make a much larger business that the doctors sort of maintain control of.
Yeah, so
But only the elite of the
we're
elite.
inviting only the best of the best to join us.
So
and we're gonna
explain
be in
that
this.
to us. You always, I like how you explain it. That whole analogy with the
Well,
hotels of the world. Can you?
yeah, well, basically, we just want to be, everybody shares things at meetings, we publish things, but by teaming up with the best of the best, you can be sure that you're offering the best to your patients and stay at the elite level. Imagine we're like the dream team from the Olympics with Michael Jordan and Larry Bird and for some reason Kevin Leitner.
And really, I think something super important is that the history of our industry is very competitive. So I'm not going to teach you what I do because then
I already know it.
Because you already know it. But people don't want to teach each other things.
That was that
and
competition thing.
They're sort of hyper competitive, and even really between our specialties, there's been a lot of bad blood, and a lot of competition and infighting. And so what we're doing is completely the opposite of that. So we're working together. We're partnering. We're figuring out like, what do I know that you don't? What do you know that I don't? Probably more. But we're figuring out how to help each other, and with economies of scale and sharing best practices and pooling our data, we should be able to create an environment where we all do better.
Yeah,
I love that. A community.
I feel like we should get a drum circle going.
Not competition, but community. I love that, and I think it's something that we've been working on. You guys have been working on it we've been working on it for a decade to really find the right people to join, and we've all been like a year or so to make this happen. So it's fabulous. So now let's go into something that's awesome, right? Where the elite, it's like the best hotels of the world. What do you call that?
Yeah, like the great hotels of the world.
The great hotels of the world. You just know that if you want the best of the best, you pick the best hotel of the world in Boston, Blackhawk, California, in Florida, wherever you're going, and that's where you find the best practice. But now let's talk
get to the secrets.
Yeah, let's get to the secrets. Hair. You have fabulous hair.
Sure, we can talk about hair.
I think we should talk about hair. That's like something that you are really well known. I mean, you're known for a lot of things, but hair is one of those things. So,
give us the dirt.
Here's the dirt.
Like the secret.
When I was a resident, some of the guys were doing a hair transplant and were begging me to help them. And my reply was, over my dead body will I ever do a hair transplant.
I know that kind of sentiment.
And I think that in the past that the results were not that good. And I didn't want to really be a part of it, you know, and now that the technology has caught up and you can do something that's virtually invisible and the results are so fantastic, it's like, why not, right? So many men need it and women.
Yeah.
And it has such a huge impact on their life that I love doing them. I mean, it's fantastic. It's easy for a patient to go through. You spend a long, boring day. It's all under local. You wait a little while. You grow a bunch of hair. It's permanent. It's really a fantastic procedure. And
so do you find like your patients, like their boost of confidence, like goes
big time?
How quickly? When do you start looking normal?
Yeah, when do you start?
So if you had a hair transplant today,
Are you saying I need a hair
in
transplant
about well,
no,
we can talk. Yeah. So in about 2 weeks, you'll look like not much happened, right? And then in about 4 months, 3-4 months, the hair starts growing. But it's sort of like a seed. It comes out, and it's a skinny little windy thing, and it's growing into a tree. And so you have to grow it, you know, into a tree. A hair has a 3 to 5 year lifespan before it falls out and starts again growing a new tree. And so as it gets taller, it sort of thickens out. And so you see hair growing at 3 or 4 months, but it really isn't like full result for well over a year.
Absolutely.
That is so that's a huge secret right there, because I think most people think, oh, I'm going to put my, you know, do the
I'm ready tomorrow.
And then, and I think that that's really, what you just said is so important, how it's like a tree that you need to thicken and get a little bit larger. And do you find that PRP like helps that? Because I've always heard that that's the miracle grow. And, you know,
so we do a procedure pretty often, actually. We call it a hair max. And so we have sort of proprietary group of ingredients, and we needle that into the scalp, and then as well inject PRP. Okay. So usually we're doing a combination therapy.
And that is effective. Like, what do you think? Is that a fair way of saying that's the miracle?
That's one of the secrets. Yeah.
Well, it's a pretty effective medical treatment, right? So you have your medical treatments, and then you have your surgical treatment. And the medical treatments is, how can I slow down what I'm losing, or hang on to, you know, what I have longer, right? So your genetics are going to determine your end point. And it's like, when is that going to happen? Is that going to happen when you're 35, 45, 65, right? And the medical can extend the length of time that you hold on to your native hair, right? And then the surgical is replacing the hair that's lost.
All right. For or against topical finasteride, minoxidil, Rogaine, all those new preparations?
When you're microneedling them in, we use topical, and those are part of the
concoction.
Yeah, part of the concoction that goes in.
All right.
But one of the things I'm a fan of is oral minoxidil, right? Which is as opposed to topical Rogaine. That's Rogaine. Yeah. It's by mouth. So minoxidil was made originally as a hypertension medicine. Blood pressure medicine. And so the doctors were giving this to people for hypertension, and then they were noticing they all come in looking like gorillas later. They have hair everywhere, right? Yeah. And so we figured out that it really is good for hair, and we take a much smaller dose than when you use it for blood pressure, just like a little whiff of it. And so that's a super common thing in our office, using oral minoxidil.
For animal fans out there, these medications were not tested on gorillas.
Right.
FUT or FUE?
Depends. Answer depends. Most of the time, we do FUE. FUE means taking out the grafts individually, and so you have these little point scars that are, you know, less than a millimeter, right? And so that's individually taking out grafts. FUT means more of the strip, which means you cut a strip off the back of the head and then take that and chop it into the grafts, right? And so that's a little bit older method. If you have short hair like you do, and I typically do, the scar can be seen, and it's a big downside, right? And so you'd be much better candidate for FUE.
Yeah.
But Onir, do you want to shave the back of your head? Probably not.
Does it
right?
look to you like I need any hair transplant?
So a lot of times for women, we can do an FUT because their hair is so long, you're never going to see the scar, and they never have to shave their head. And so we'll do an FUT. Or really, even more common is I do a hybrid. So we'll do a strip on the women, and then also shave a smaller area, maybe an inch across, and then get some more FUE. That way we can get really a lot of grafts, and they really don't have much of a donor shaved area.
So that's actually, I think that is super interesting, because so many women, when you start to go through menopause, you start to lose hair, and even if you had really thick hair, it just thins out.
What are you doing there?
So yeah.
So I think in general, women respond to the medical treatments better than men, right? And so
men are very stubborn.
Yeah, and it's just genetically our hair gets hammered, I think, more than women and earlier on. And so a lot of the medical treatments like a hair max and PRP are more effective in women than I think in men. So we'll sort of hit them with all of that, up front as much as we can. And then enough, plenty of women have lost enough hair that we'll do that and do a transplant at the same time.
People are talking now about no shave FUE.
Yes.
Tell me about that.
It's very tedious. So, the idea of cutting and picking, you're not going to get so many grafts done.
Yeah, much less efficient.
A lot less grafts done. And it's like, if you've lost hair enough that you're getting a hair transplant, odds are you need a lot of grafts, right? And so the more grafts you can do at one time, the better. The more hair you move up there, the more of a result they have. It's pretty simple, right?
Yep.
And so when you're doing it and you want to commit and you're going to spend the day, get as much hair as you can, right? And so going back to why would you even do not shave your head FUE, right? It's because someone doesn't want to shave their head. In the past, we used to do shorter haircuts and then shave this area to do an FUE. And then we found over time, if we just cut everything short, we found that the patients like it better. It's counterintuitive. So I've had plenty of guys I've done a couple times that had shorter hair in the front and then shaved in the back, and versus just shave it. And after doing it both ways, the commentary from them is it's so much easier just to shave it. And and I didn't think that would be the case, but in general, afterward, most of the guys like just shaving more area.
So you're happy in general that the mullet is not so popular anymore.
Exactly.
All right. Well, these are great hair secrets.
Awesome.
One more question. What's the strangest place you've put hair grafts in? You don't have to tell us that if it's too. This is a family podcast.
Scalp. We've done some beards. We do eyebrows. That's it. I mean, they're not that strange.
Yeah, right? Not so bad.
No.
Yeah, no chest.
Okay, so
how about harvest?
Where did you? Yeah.
Okay, so the traditional area of harvest, except for one. So I had this gentleman who had several flaps and plugs and then strip and FUE, and he just was, at the end of the line for everything they could do, and none of it was that great. He was this Italian guy. He was super hairy. He had hair on his chest and abdomen that was like this long and thick and straight, remarkably. And so we actually harvested his belly and then put more, none at the perimeter where you'd see it, but more sort of centrally in his head to give him some more density. And it worked out really pretty good.
I love that.
But that is a one-off.
Yeah.
Most of the vast majority of the time, that's just not going to work.
Nothing off the top of the foot. Yeah. All right. Outstanding secrets. Thank you.
Yeah.
All right. Excellent secrets for hair. If you are anywhere west of the Mississippi, go see Dr. Ronan at Blackhawk Plastic Surgery for your hair needs. You can move it from anywhere to anywhere. I'm sure he didn't tell us all the secrets, but there's more to it. And if you're east of the Mississippi, come see us at the Spiegel Center for hair grafts. We do it as well. And now we know all these secrets to add to what we already do. So thanks for coming out. A great member of the premier plastic surgery family.
Yeah, and thank you for listening to Plastic Surgery Secrets Talk.
If you like what you heard and want to get in touch with us, you can call 617-566-3223. Email us at info@drspiegel.com, I before E, and there are no A's in that. Or follow us on social media at Dr. Spiegel.